So it looks like we have some technical difficulties.
Están dejando a la gente entrar, más de 270.
Okay, well, technology always is our main boss. Good morning, everyone. Bon dia. Bonjour tout le monde. Buenos días a todos. Let me welcome you all to the PAHO World Health Day event, Our Planet, Our Health. My name is Marcos Espinal. I am the Director of Communicable Diseases and Environmental Determinants of Health at the PanAmerican Health Organization in Washington. I will be your moderator. Let me just inform you that we have translation into the 4 languages of PAHO: French, English, Spanish, and Portuguese. So you can choose. World Health Day theme today is mainly a call for action to improve health and well-being, prevent avoidable causes of disease and death by protecting the environment. Let us remind ourselves that the COVID-19 pandemic has highlighted the fault lines of inequity across the world, underlying the urgency for creating sustainable well-being societies which do not breach ecological limits and which ensure that all people have access to life-saving and life-enhancing tools, systems, policies, and environments. The World Health Day reminds us that this environmental crisis of climate change and pollution is a serious public health problem. But also another serious problem is access to water and sanitation, chemicals that can harm our people. Let us also remind you that PAHO and WHO are the custodians of many SDGs, of Sustainable Development Goals. I have asked Harold to help me with one slide that I want to show you to set the tone of this event. Harold, please. What you see here, it's in the center, SDG 3, good health and well-being, ensure healthy life and promote well-being for all at all ages. And this is surrounded by 5 key SDGs that interact with health and determine actions and policies that we need to implement to tackle them. SDG 6, clean water and sanitation. SDG 7, affordable and clean energy. When we talk about fossils, burners and fuels. SDG 13, climate action. And we don't need to tell you about hurricanes, landslide, floods, and so on. SDG 12 and SDG 11. So all very interconnected with health. So the bottom line is, in order for us to achieve SDG 3, we also need to tackle these pressing environmental public health problems. Thank you, Harold, for this slide. And for that today, the PanAmerican Health Organization, we have a stellar lineup of speakers that will address you, will share with you best practices, and will tell you the way forward on innovation, like, for instance, the One Health, that it's a recent policy created by the PanAmerican Health Organization to promote collaboration and make sure environmental determinants are addressed in an intersectoral, interprogrammatic way. Our agenda today, it's headed by Dr. Carissa Etienne, Director of the PanAmerican Health Organization. We welcome also Dr. Jacqueline Alvarez, Director of the Latin American and the Caribbean UN Environmental Programs, UNEP, and three wonderful honorable ministers, Dr. Jose Manuel Mateo, Secretary of Health of Honduras, Dr. Carla Bisotti, Minister of Health, Argentina, Dr. Christopher Tufton, Minister of Health of Jamaica. We will close with words from our Assistant Directors, Dr. Jarbas Barbosa. So without further ado, let me again thank you all for coming in and listening, and let me give the floor to our Director, Dr. Etienne. Please, Dr. Etienne, the floor is yours.
Thank you, Marcos, for framing this engagement this morning. Let me greet Dr. Carla Bisotti, the Minister of Health of Argentina, Dr. Jose Manuel Mateo, the Secretary of Health of Honduras, Dr. Christopher Tufton, the Minister of Health and Wellness of Jamaica, Dr. Jacqueline Alvarez, Director Latin America and the Caribbean of the UNEP program. And let me also greet our PAHO and WHO colleagues, our honored guests, and really esteemed ladies and gentlemen. Good morning to you all. Over the last 2 years, we have lived through what are the devastating effects of the COVID-19 pandemic. Millions of lives have been lost, the world's economy severely disrupted, and our societies continue to grapple with the far-reaching and overwhelming consequences of COVID-19. Billions of people are still without reliable and affordable access to medical treatment and vaccines against COVID-19. The persistent inequity and the weakness and limitations of our health systems and the level of preparedness have been both exposed and exacerbated. And the COVID-19 pandemic has again reinforced the urgent and imperative need for universal health that is built on the foundational principles of primary healthcare and deeply rooted in a meaningful commitment to equitable policies, practices, and high quality care systems for all. We live in what has been termed the most inequitable region of the world, where wealth and social inequality are widespread, and where the greatest impact from COVID-19, other communicable and non-communicable diseases, is borne by those communities living in conditions of vulnerability. We've also learned that health must be urgently repositioned in all policies, and that an all-sector approach must be prioritized. The social and environmental determinants of health can only be successfully addressed through multi and intersectoral engagement. One Health is a mechanism that aims to foster coordination and collaboration between the different frameworks of human, animal, plant, and environmental health to better prevent and prepare for current and future health threats at the human, animal, environmental interface. So the so-called triple planetary crisis of climate change, loss of biodiversity, and pollution is impacting the health of all people, as well as our people and the health of our planet. So those effects are amplified by deficiency in infrastructure and health systems to prevent disease and effectively respond to crises, disasters, and emergencies. Animal health and the health of our environment are inextricably linked with people's health, how we live, organize our societies, and produce and consume goods. Over the past 3 decades, we have witnessed concerted global action to build a sustainable planet. Since the UN Conference on Environment and Development, also known as the Rio 92, and more recently via the Millennium Development Goals and the current Sustainable Development Goals. During this period, we have seen some notable enhancements in health services and improvements in the health of peoples of the Americas. For example, intersectoral collaboration among the health, water, and sanitation sectors has reduced the mortality risk among children under 5 years, from 219 to 23 deaths per 100,000 population. And that represents 1.8 million young lives saved since 1990. Nevertheless, every year in the Americas, an estimated 1 million premature deaths are attributable to non-avoidable environmental risks. Air pollution, contaminated water, inadequate sanitation, including solid waste management, risk related to certain hazardous chemicals, and adverse impacts related to climate change are the most pressing environmental public health threats for our region. It is unacceptable, really, that in the 21st century, approximately 431 million people in our region still do not have access to safe sanitation. And of this number, 9.9 million people still practice open defecation. 161 million people still do not have access to safe drinking water, resulting in about 30,000 preventable deaths each year. Household and ambient air pollution is linked to almost 320,000 preventable deaths per year in this region due to stroke, heart disease, lung disease, and cancer. Almost 80 million people still depend on polluting fuels, such as solid fuels or kerosene, to support their needs for lighting, cooking, and heating. A problem that disproportionately affects mostly women and children. People are still being exposed to hazardous chemicals, such as mercury, lead, and pesticides, which not only jeopardize the health of the persons that are directly exposed, but also that of the unborn children in utero, who can suffer ill effects throughout their lifespan. Extreme weather events can directly increase the prevalence of some diseases and cause injury and death. Additionally, changing climate patterns can modify human health by exacerbating food and water insecurity, population migration, and compromising mental health and altering the usual transmission patterns of zoonotic and waterborne diseases. Those living in poverty, in precarious housing conditions on small islands and coastal areas are at greater risk due to more frequent and severe weather events and rising sea levels coupled with a reduced ability to adapt. New environmental related hazards to health are increasingly being recognized. For example, exposure to substances in electronic waste, the environment and health effects of micro and nanoplastics, and increased antimicrobial resistance, only to name a few. To further address these challenges and to help our member states advance, PAHO last year launched the Agenda for the Americas on Health, Environment, and Climate Change 2021-2030. This agenda will benefit all countries and territories by promoting good governance practices, strengthening the leadership and coordination roles of the health sector, fostering cross-sectoral action, focusing on primary prevention, enhancing the generation and use of evidence, and improving communication to promote awareness and action. Today's World Health Day theme, Our Planet, Our Health, is a call not only for a green and healthy recovery from the COVID-19 pandemic, which places the health of individuals and the planet at the center of actions and fosters a movement to create societies focused on well-being, but it is also an emphatic appeal for extra transformative efforts to protect the health of the most vulnerable populations from environmental risk. We can do this. We can do this together. I wish to remind everyone that this year PAHO is proudly celebrating 120 years of providing solid and uninterrupted technical cooperation in public health to our member states. And one key observation which has emerged is that solidarity and cooperation have been preeminent among our region's greatest strengths for more than a century. So this is the time for member states to recommit to regional solidarity and to strengthen our individual and collective actions to better protect our health, that of the future and unborn generations, as well as the health of our planet. Really, the future depends on us, as we are not only the custodians of today, but the architects of tomorrow. And thank you again for joining us in this World Health Day event. Thanks.
Thank you very much, Director Dr. Etienne, for your inspiring words and setting the tone and the way forward. Clear words that needs to be taken very seriously if we want to reach the 2030 agenda and tackle all these environmental threats that are affecting and impacting our health. La doctora Jacqueline Álvarez es la directora para Latinoamérica y el Caribe.
Dr. Jacqueline Alvarez is the director of the UNEP, and it is fitting that she is with us. We have an MOU with UNEP, and therefore we thank you for your participation, Dr. Jacqueline Alvarez, and over to you.
Muchísimas gracias por esta cálida bienvenida, doctor Marcos. Y para nosotros es un honor trabajar con ustedes en el ámbito global, en el ámbito regional, en el ámbito nacional. Es esencial esta coherencia en los trabajos de ustedes y nosotros.
Of what
Voy a
we do
pasar
and
al
what you
inglés.
do. I'm going to switch over to English.
En principio y antes de quería saludar
before that, I wanted to
calurosamente a la
give
doctora
special
Carissa, al
greetings
doctor José Manuel, a la
to
doctora
Dr.
Carla,
Carissa,
al doctor
Dr. José
por
Manuel, Dr.
ser
Carla,
parte
Dr.
de este
Christopher,
proceso y
for
de este
being a part
evento.
of this event
So,
today.
colleagues, friends, what we have understood better over the last year is that environment matters to One Health more than ever. We heard that 50 years ago in the Stockholm conference, but now we have all the elements that we need to really strengthen this concept. At the 5th United Nations Environment Assembly, which concluded about a month ago, we heard a clarion call for investing in environment to solve development and health challenges. We heard a call for everyone to open their doors and work with a unified vision rather than going into fragmented agendas. The resolutions passed at UNEA by member states, it's ministers of environment, but at the end, it's member states that belongs to all of us. It made a very clear statement about the environment stakeholders, indicating that all of us are ready to work with the sectors and hope that these sectors, actors, will reciprocate. We need to really work together. I will highlight some of the results of the assembly because it really deals with environment, health, biodiversity. So there is a very important resolution for us, which we are calling the Paris for Plastics, which is a resolution to end the plastic pollution. And now we are starting to forge a legally binding agreement that by 2024 needs to be ready, the text of that. And it calls upon the full life cycle of plastics. Many of you have learned about plastics because of the marine environment and because of the pollution that it is there. But at the end, plastics is much more than that. We have seen very recently the presence of plastics, not only in the human gut, but also in the blood of humans. What does that mean? We still don't know, but we know as well that when things that are not supposed to be in a place are there, they might not be good. We had also a resolution on biodiversity and health calling on member states to support the One Health approaches when dealing with national things and elements. It specifically asked UNEP to join the tripartite, and now we can really be very glad to announce that we are a quadripartite, if that's the name we are called. But what matters more is that we are working together, and the pillars of One Health are really being addressed from the core. We also had a resolution on nature-based solutions to improve everything related to food security. Food and health is really critical, and that's an aspect that talks not only about the GDP of a country, but it talks about the quality of life for the people that live with us. We had also another very important resolution, which will be, in our understanding, a game changer, and that is a resolution on science, policy, and pollution, to establish a panel to discuss the elements of the scientific finding, the science evidence-based knowledge, and connect with the policy makers. Finally, in relation to UNEA, there was also a ministerial declaration recognizing the risk of future pandemics if humanity does not really learn how to interact with nature. And in here, I'd like to stress what Dr. Carissa was saying on the antimicrobial side of the things. And the big scale situation with all the unfortunate deaths, that UNEA sent a very clear message: a healthy environment equals healthy people, healthy animals. So in a way, we cannot divorce the measures that we do. We have also another important example, and maybe going some years back, which is the Minamata Convention on Mercury. And at that moment, and as you know, the Minamata Convention is a multilateral environment agreement. But what makes a huge difference is that it has an Article 16, which is called health aspects. And in there, it is very strongly recognized the importance of promoting, implementing strategies, programs to identify, protect populations at risk, particularly vulnerable populations. But it also refers to the science-based health guidelines related to exposure to mercury and mercury compounds. And that happened some years ago, a decade ago, practically, that these very well the things. I would also like to delve a little deeper into the pollution issue, which is critical in the context of One Health. You have heard, and all of you know these numbers by heart, but I keep on repeating them because they are overwhelming. 7 million people pass away earlier each year because of air pollution. Hello, that's the double of the country I was born, the double of the population of the country I was born. So twice that level of population is dying. So my country will be phased out of the world every 6 months. Dirty air also it increased also severely the mental illnesses, all the mental health related aspects. And 99% of the global population are breathing air that exceeds the WHO guidelines. The scale of the threat is really, really huge. Water pollution, what can I say? It kills. We all know that. And we know that people die, millions of people die each year of diarrhea from contaminated water, chemicals in our environment. 1 out of 3 children have lead in their blood at levels that might be associated with decreased intelligence, behavioral difficulties, learning problems. Yeah, lead is part of our earth, but we are not managing it in the correct manner. There is a huge cost, and at the end, the human existence is in jeopardy. untreated waste, pollutants from industry, mining. What can I say about mining in this region? You know it very well. Agricultural activities, oil spills. We have had one not that long ago in Peru. Toxic dumps destroying our habitats. Colleagues, we have a lot of work to do. Plastic pollution treaty can be, we hope it is a game changer. Also, you have heard these numbers, but 7 billion of estimated tons of plastics produced, 9.2 out of that are being dumped, are waste. It's too much. Bring into the environment 17,000 tons of plastic waste every day. Imagine those numbers. How many vans, how many cars, how many infrastructure needs to be put together to get into 17,000 tons. With this waste comes health risks. You know, fertility, you know, hormones. Plastics are not only products that we use. Plastics contains additives, contains chemicals, and some of them have been proved to be persistent organic pollutants. The Stockholm Convention enters into force here. Plastics are also related to greenhouse gas emissions. That is, of course, associated with the production side of the plastics, but also to the use and the disposal. 1.5 for all. And this is one of the elements that we always need to bear in mind. I present this picture really not point out that we have the chance to really change the game, and that will bring economic benefits. It will bring social benefits. It will bring behavioral consequences that we really need to deal with. Getting it right could also create a model to move into a more circularity in sectors, for us as consumers to learn how to choose things in a best manner. What works for, and I will repeat again, plastics can be used for energy, for transport, for construction, for creating jobs, for mitigating the triple planetary crisis Dr. Caris. And of course, that is improving our health, the One Health. At this time, when our planet is growing sicker, people and animals are also getting sick with it. We need to work in this quadripartite alliance on One Health. That is of extreme significance and importance for UNEP. We saw a revised definition of One Health with the support of the One Health high-level expert panel, and we are very happy with that. In the meanwhile, we have prepared a report which is called Environmental Dimensions of Antimicrobial Resistance, and 5 main sources have been identified. It is sometimes hard to get the connection, and in this arena, practically the health of the people and the animals were at the center, but we know now that without dealing the transmission, the spread of antimicrobials in the environment, we are committing future suicide. What is apparent to
Dr. Alvarez, I'm afraid we have 1 more minute. Yeah.
Oh, okay. I'm very sorry for that. So we'll be closing. UNEP is really pleased to be working with PAHU through the joint action plan to serve better countries in an integrated manner, environment and health. I'm very sorry for the long speech.
No. I just want to make sure all of you have the opportunity to, but very scary numbers you gave us, and 7 billion plastics. So really, we need to act now. So, and we look forward to continue working with you. We have a memorandum of understanding, And indeed, as you said, now, 2 weeks ago, 3 weeks ago, Dr. Tedros welcomed UNEP formally into the alliance with FAO and OIE. So I think it's excellent together. And you mentioned One Health, which is an innovative diseases, AMR, environmental determinants, food safety, and others. So I thank you kindly and apologize for reminding, but thank you for coming with us. Let me now and darle la bienvenida.
And I would like to welcome Dr. Jose Manuel Mateo, who is the Secretary of Health of Honduras. We are very pleased since Honduras has now a new government, and we would like to congratulate you, Mr. Mateos. Challenges ahead of you, but we all to face them and take Honduran people to an improvement in health. Welcome, Dr. Mateo. You have the floor. Good morning. Good afternoon to be here with you today. The world is changing. In my country, we have, for the first time, a woman president. And today I have to speak after two ladies, Dr. Etienne and Dr. Alvarez. It is a pleasure for me to greet you today, also to greet our colleagues, ministers, and also the Assistant Director of PAHO, Dr. Barbosa, and all of the ladies and gentlemen who are here with us today. Health and well-being are closely related to the environment around us. It is a virtuous cycle, and in that cycle, individual collective conduct, state policies, and company conduct also have an impact on better health for the community and the individuals. At the same time, they foster sustainability on the planet, the only one we have. The topic today, our planet, our health, such a short phrase with so much meaning. This is the only planet we need to love and take care of, confirms the situation in which Honduras is very well informed. Right now, we are going to state what our government, a government and administration that just changed the budget, focused on the human being. Last night, in the wee hours, we approved an increase for $100 million for the budget on health. This is a government that has a human vision. We are aware of the limitations in the area of health in all of the countries, and in our country in particular, we are aware of the damage for the health of the people when they do not have proper conditions in their family environment. The use of biomass, the use of fuels that are leading to an increase in chronic respiratory diseases, asthma. We have reviewed some of the figures of deaths in our country of individuals who die due to chronic obstructive pulmonary disease, to see that they're mainly women, children, and the elderly. This led us to make decisions and short environment and agreement that will have us choose a different path for the care we will provide to our population. The world is changing, but it should change for the better to allow for the future of our world, the future of our children and grandchildren continues to go backwards. The biomass fuel combustion has, as I mentioned before, in our country, for those that the marginalized population, I would like to reiterate that our country has a commitment now more than ever to foster well-being. We have an unacceptable percentage that is about 1 2.12 million houses that use wood burning to cook. 55% of the population is exposed to the combustion of biomass. We had already mentioned mainly women, children, and the elderly. Based on a World Bank study of 2007, a little bit outdated, and that referred to the Honduras environmental risk dollars, 4,400 million lempiras. Most of the cost comes from water, improper sanitation that represent about $91.5 million, and then contamination or air pollution indoors that has an impact on the rural population, and that continues to have an important impact on urban population with an estimated cost of more than $56 million a year. The cost of pollution, the cost of urban air at $48.5 million, and due to the differential exposure and also the activities that are involved, children are disproportionately affected with these risks to their health. 57% of the cost from the public sector in connection with health were related to health for children younger than 5. As to environmental risks, about 22% of child mortality in children younger than 5 is attributed to water, improper sanitation, and contamination of indoor air. And about 3% of adult mortality is attributed to contamination of indoor and outdoor air. And based on these indicators, we are making a decision as a government and for health to be the maximum expression of human well-being. And for this administration, the human being is a priority. The health is the thermometer of the development of a country. The World Health Organization has estimated that in 2016, there were 2.2 million deaths due to solid fuel combustion, and a great deal had to do with children younger than 5 years of age. If we think of the damages to health and also the impoverishment of the population and the work hours that were lost for wood collection and the use of solid fuel, this becomes a key issue for state policies now to try to implement an effort to migrate from biomass fuel to healthier fuels at home is something that requires sectorial and institutional work. That's the reason why today, as we celebrate World Health Day, the interpreter apologizes, but there was an interruption in the connection.
Para proponer soluciones intersectoriales.
So we will be working on a roadmap to propose high impact solutions. And also from the point of view of the Health Secretariat, we will be fostering resilient, green, safe hospitals to improve hospital infrastructure. We already have a sustainable hospital, our National Institutional Cardiopulmonary Institute. This will be more work for the state, but for the first time, we are providing warm water to our patients for them to be able to take a bath. This National Cardiopulmonary Institute is a model as a green institute. We're on one. The current administration, head by our first lady president, Ms. Sarmiento, is attempting to improve policies, state policies at different levels on the one hand, in connection with healthier and cleaner fuels. We're also seeing policies that are directed to marginalized sectors and also rural sectors. We're promoting private-public partnerships to attain cleaner technologies such as improved stoves. We're trying to have a transition so that the people from Honduras can stop using wood-burning stove and move on to cleaner technologies. The involvement of different areas of the administration, from decision-making to the construction of public policies for greater frameworks and regulations to find a solution and provide better technologies for cooking, and will also have a better impact on the health of the population, is a priority for this administration. For that reason, on this World Health Day, when we have the opportunity to join the concepts of our planet to the concepts related to health, we need to take the advantages of the public health sector, including decision-making in connection with the environment, health, and energy, with a focus on health. The president, Samara Castro, is also stating different axes for addressing poverty, focusing mainly on the health of the population in a cross-cutting manner, health that is built based on prevention of diseases and also access to better services and improving the quality of life by better well-being at home. And for that, we also need to preserve nature, and we are working. So health for everyone wherever they are. Thank you for listening to me. And I need to leave the meeting in a few minutes to participate at the regional level that will be held next door. It's a pleasure to be here with you. And on behalf of the government of the First Lady President in Honduras, Xiomara Castro, please have our commitment. This country is now focused on the human being and on the health with quality for all. Thank you. Honorable Minister, thank you. Thank you. You already have a roadmap to eliminate the use of wood in your country. We congratulate you, and PAHO will be with you always. We will be working with you. Our representation in Honduras will be working with you. So we are here at your service together with Dr. Etienne. We wish you the very understand that you have another commitment with the local event. We wish you success, and the intersectoral aspect is key to improve the health of children and Honduran mothers. Congratulations, Mr. Minister. Thank you very much. Now we're going to move on to Honorable Minister of Health of Argentina, Dr. Carla Bisotti, who is familiar to all of us and who is a very broad collaborator here with PAHO, who is always supporting these initiatives and working next to PAHO. Argentina is a country that has always supportization rather, and we will continue to support Argentina in their fight against the environmental determinants. And Honorable Minister, you have the floor. Good morning. Thank you very much. It is a pleasure to greet you, Marco, to greet the director and all of the presenters, everyone who is connected today. We are from San Juan, a province in the Cuyo area, close to Chile, with the Minister of Health. That's why we have the flags of Argentina and San Juan behind us. And we'd also like to thank the invitation for Argentina to be part of this global challenge and also this regional challenge and also the challenge we face in our country. World Health Day should be thought as something relevant to the environment, to health, and to environmental change in our planet, our health. The ones who are in the area of health knew that health was a priority, but the pandemic gave us a new dimension as to the meaning of the fact that the world has no health, that there is a situation such as the one we had from the health point of view, social, economic point of view, as well as the productive point of view and the labor point of view. It is an incredible opportunity to be able to transform a crisis into an opportunity to support health at the core of the situation in a cross-cutting manner, and also to be able to generate the other health determinants and be able to think that the population can empower and have health as a right, not only when they are threatened, when it is lost, but also and mainly to have health preventive actions. And to that end, we have also said for a while now that health is a collective issue. It has to do with the person, whoever surrounds that person. And to that end, PAHO's director, as well as Dr. Alvarez, have commented on the global problem. So, and in our region, as we heard, we need higher equality. This is one of the areas pandemic great the most to be able to overcome those difficulties in access to vaccines. In South America, we have the highest percentage of vaccinees among all of the hemispheres. So from that point of view, we have challenges, we have difficulties, but we also have a health team, and we have a regional view and outlook that gives us the opportunity to make progress. I would like to share with you how we are working in connection with this topic. This is a very important topic at the level of the president, and all of the ministries are currently working on that. And in Argentina, we have an environment ministry, and we work with it very closely. In 2019, the law on minimum budgets for adaptation and mitigation of global climate change cabinet was built in Argentina. This cabinet has the role to articulate the various areas within the government clearly, including the Ministry of Health of Argentina, to implement a national plan for adaptation and mitigation of climate change. A few weeks ago, our president led that cabinet that meets periodically. It present their actions and coordinate. And I should also share with you that starting in 2008, our Ministry of Health started to work on climate change and health. We started to work on baselines to the impact of climate change on health. We also created different regulations. Argentina is a big country, it's a federal country, so we always work from the Ministry of Health. We always work hand in hand with the various jurisdictions, and also with the scientific community, and clearly the PanAmerican Health Organization as well. Evidence-based consensus to create regulations. We also work knowledge, in particular in the area of environmental health. I would also like to share with you that over the last couple of pandemic, we were able to strengthen governance in the area of climate change within the Ministry of Health. When we took office in 2019, we started to analyze the national program for the reduction of health risks in connection with climate change. It be as an articulatory body, is an interministerial and cross-cutting body. We coordinate a working table on climate change, and clearly this program is the one that represents the Ministry of Health within the cabinet. We also created this table through a ministerial decree. We formalized this environmental table, working table within the Ministry of Health. In 2021, it became formal. We have 10 areas of the Ministry of Health, and this is a very important cross-cutting approach to climate change and climate impact on programs and policies that we are working on from the Ministry of Health of the nation. And we're also working on completing and starting to implement this national action plan on health and climate change, as well as risk prevention for health in connection with extreme climate events. We have also been working closely on climate change as part of a strategy to replace the 2019 plan of action so as to reduce the comorbidities and co-mortality in connection with climate change through measures to protect and prevent health problems, and also to develop a health resilience system, a reduction of emissions. And this strategy includes 21 measures, 14 for adaptation, 3 mitigation, and 4 cross-cutting nature, and with 5 cross-cutting approaches based on course of life, gender diversity, integrated risk management, and also fair health. From that point of view, the goal is quite ambitious and the outlook is comprehensive, and at the same time, we federal outlook. From that point of view, we have several projects. For 2020, our ministry presented a project to increase the capability of the health sector and also to strengthen the climate situation in Argentina, national and regional level. This is the first time that this fund grants funding to a Ministry of Health. So from that point of view, our work has been intense, and we're also very proud to have obtained financing for a 12-month project that will allow us to strengthen governance in the area of climate change at the subnational level. It is quite relevant to continue to work with the jurisdictions and also to have pilots in 3 provinces of the country where we created working tables on climate change at the level of the provinces, and also provincial plans on climate change, and also improvement of the government, measurement of climate change in 3 hospitals, and also mitigation measures of life and green spaces. And we also develop projects for new funding on an external basis. Another project that, or another grant at the national level within the framework of the United Nations on climate change was also key in integrating guiding principles for the project. And we also worked a great deal on the early warning system for extreme heats, and also we work with the National Climate Institute. We're also working closely in connection with these topics. I would also like to share with you that we have a national hospital that is the National Reference Hospital for Health and the Environment, and the goal is to work as part of a network with the rest of the country in connection with the work of the green, smart, resilient hospital. And since this is a national hospital, we would like to be able to create this network on health and the environment to reach to all of the hospitals and health centers throughout the country. Therefore, challenges, but we are against what some of the countries in our region are doing, and also the role of the organization, the PanAmerican Health Organization, to be able to strengthen us as a region. I think that this is quite relevant. And if you allow us, I think that we have a 30-second video explaining how we are going to continue working for health to be more affordable and with a comprehensive view as to what it means to have one planet, one health. So this is our environment, those who surround us. We're talking about working for affordable health, effective health for all. Our planet, our health. Argentina cares. Of Health, Argentina. Thank you very much for your excellent remarks in the video. a comprehensive, inclusive outlook, gender approach, including everyone. Very important, and clearly the Green Fund for the first time is granting, and out of all of the WHO areas, it was the first grant to a country to work on climate change and health. And we understand that the Green Fund has also authorized this for the Caribbean countries. So we thank you, Madam Minister. We hope you remain with us for the discussion, for the 10-minute discussion. Y en último,
who is a commoner, a frequent flyer, always with us and always responding to our request for participating in these events. Minister, thank you very much for being such a friend and being such a good friend of PAHO and for your time. We know you are very busy, and we didn't want to leave you for the last. Our lady is yours. The micro is yours for how you are fighting, your people are fighting climate change, environmental determinants, and their impact on health. Thank you, Minister. Floor is
Thank you
yours.
very much for those kind words, Ms. Master of Ceremonies, Dr. Espinosa, the Director, Pan-American Health Organization, or very good friend of Jamaica, as is of the hemisphere, Dr. Barbosa, Assistant Director of PAHO, Dr. Environmental Program, my colleague, Ministers of Health from Honduras, Argentina, ladies and gentlemen, good morning, or to you all. No more than said by the speakers before me, it is so vital for us to accelerate efforts to realize climate resilient health systems in the Caribbean, as indeed in the world. But given the looming climate crisis, vulnerable in these parts of the world. Caribbean SIDS, or small island developing states, given their small size, struggling economies, and climate-dependent industries such as tourism, are especially vulnerable to climate impacts and threats. Caribbean SIDS have many of their critical infrastructure along the coast, making sea level rise and coastal erosion a particular challenge. Also, an estimated lives along the coastline. Growth and increasing demand for land in these areas are only expected to continue. Further, the geographical location of extreme weather events experienced over recent years, with hurricanes of up to Category 5, represent danger to our inhabitants in these parts. Still, it is my considered view that the health impact of climate change make most compelling case for the comprehensive and collaborative push towards him. We support PAHO's agenda for the Americas on health, environment, and climate change 2021-2030. The Health and Climate Change Country Profile Project forms the foundation of WHO's monitoring of national and global progress on health and climate change. Significant the need for more aggressive action. Among these things, climate change threatens to exacerbate today's health problems, to include injury and death due to extreme weather events, including flooding, increase in mosquito-borne diseases such as dengue due to heat impacts related to high temperature days when measured in some cases, increased numbers of ER visits, hospital admissions, and even deaths. There are challenges of undermined water and food supplies, social protection systems, in addition to the long-term consequences for mental health, and the displacement of the recent experience is that can be made in our public health response, given the political will, the commitment to mobilizing the needed resources all of society. We must apply the same approach to building climate resilient health systems in the Caribbean, where we achieve transformational adaptation, mitigation, and recovery planning. Means possible health outcomes to safeguard continuity of care, even in a pandemic. Caribbean important strides, which I think and use as best practices, acknowledge resourcing the health systems to the WHO. Jamaica, for example, has embarked reflect, emphasize, and is to challenges from non-communication organization and consolidation of integrated information abilities to remote patient monitoring, e-prescription service delivery to increase services. Also, quickly, in GIS technology to these time data on health, business, health care, and health service for expand services, intensify investment in of NCDs, including greater focus on air quality. Closing, there is also the power-assisted smart health care, moving hospital operational aspects in Jamaica and others. Build on these gains, areas for and towards climate resilience management, transfer.
Thank you, Honorable Minister Tufton, for addressing our way in making the health system resilient. You know very well, PAHO will stand supporting you and the people of Jamaica. Now, we have before my doctor, it's a time for a couple of questions, Q&A, couple of important questions, or I can to a fossil fuel industry. Tough one, because we heard Minister of Honduras talking about and carbon and leña. Any reactions, Honorable Minister?
Well, in Jamaica, if I may start, incentivize and motivate alternatives to recent budget. The Honorable Prime Minister announced the importation at reduced cost at the level of the customs duties for electric vehicles up to a certain number. And we will see more of that. To take that expect will adjust. We are also, and I think this is Caribbean, promoting the use of solar energy which is becoming almost a standard feature in terms of validation, and in some instances, quite a few instances, commercial business energy supply. So, and even in the case, the staff to monitor the use of fossil fuels, the motor review of those standards to ensure that we establish higher requirements. So I do trajectory, alternatives to fossil fuels, and the adjustment by the population, I think, is taking place. The is
those Ministra Bisotti.
The reaction to
Recording in
tenemos
progress.
una disminución sostenida, necesitamos generar
tobacco, and we need to accelerate this decrease more. And so, as the minister, thank you, Minister.
For time, but I want to refer to this one is from our good friend who is a son of Pajo, Luis Augusto Galbao, Guto, who is connected. And Guto is saying, good morning, excelente evento. Los ministros de salud de las Américas han sido los primeros.
This is an excellent event. The health been the first ones in promoting health, urban health. How could the academic community support in particular of the region for the WHO committee? Yes, we are working both with civil society and with all or confront the different scientific societies, and which joins the universities and civil society, etc. And we all in an interdisciplinary way. We have supported initiatives from the state, and they have also proposed of academia with health policies, which should not be political party. We need a political will and political decision making, but we need political power, political parties, and in this sense, academia, civil society, by the so many things. Thank you. It is civil society and well, thank you very much for these two questions. We have run out now. Assistant Director, Dr. Jarba, 2 words. Thank you for here and over.
Dr. Califetieni,
honorable ministers, Minister José Manuel, Minister Carlos, Minister Chris, honored guests and esteemed colleagues, Director of the Latin American United Nations and experiences from the honorable ministers of Argentina, Honduras, and Jamaica. Protect the environment program, technical cooperation, of chemical and climate change and ecosystem assessment, working of understanding of UNEP and ladies and gentlemen, collectively we are stronger, we can move faster, and we can go further. To reach people living in situations of high vulnerability, like we learned from Honduras, protecting the health of population from island states, like we heard from Jamaica, and acting in a concerted initiative documents such as the Elimination Initiative Policy, approved at the Organization 57 Direct Council on September 2019, that includes 2 environmental conditions that can be eliminated. Health policy approved at the Organization 59 Direct Council and the Agenda for the Americas on Health, Environment, launched at a webinar states on 19 December 2021, which is our flagship document to support our countries to lead the way. We are also opening states like for project in Argentina, in our effort to collaborate to find the multi-sector and interprogrammatic solutions to these complex problems. The last 2 years have been very challenging globally and for the great resilience and how we can move quickly to also taught us needed to system and make the opportunity for us together for a better group. If we are to and we are committed to reach them, we need to make sure we pay critical attention to the environment and social determinants of health in a sector and interprogrammatic way. Thank you to our excellent speakers for the productive and informative session we had today to commemorate the 2024 Planet, Our Health. Thank you.
Thank you, Dr. Barbosa, and for your inspiring words. And that will conclude the event of World Health Day today. I thank our panelists, Dr. Etienne, Dr. Alvarez, and the 3 honorable ministers, Dr. Matteo Bisotti, and Dr. Tufton, and Dr. Barbosa. And thank you for your questions and answers. And certainly, this is a reflection for us to take forward and work all of us to make sure we tackle those environmental threats. I thank you all. Goodbye for now.